Hi everyone, welcome to another video on OET Speaking. Today we will discuss what you can do or how exactly you can utilize your 3 minutes preparation time in your OET Speaking. So let's get straight to the video. You have 3 minutes time to prepare. You can make notes, it could be mental notes or you could write down. Let's have a look at a roll card and I'll explain in detail what you can do in those 3 precious minutes before you start enacting your roll card. Alright, so what you see on screen is a roll card. There are 3 sections to this particular roll card. The first one is the setting. The second part of your roll card is given under the heading Nurse, and this is nothing else but the background information. This particular short paragraph will give you a lot of information to help you with the roll card. And the third part of your roll card is the list of tasks. So remember, you need to identify the 3 different sections of a roll card. Do not skip any of these. I know of certain students who would straight away go to the list of tasks and try and build their responses or think of how they're going to answer the tasks. But that is dangerous, because you need to start right from the top, from the settings. How will the settings help you? Let's have a look. Now the first part of your roll card is a setting, and in this example of ours, the setting is accident and emergency. So what do we really get to know from the setting? Well, the first information we can get is, are we meeting the patient for the first time, or do we already know the patient? That is, whether it's a known case or an unknown case. For instance, if your setting is a hospital ward, the chance is high that you've already met the patient before. The patient would have been in the hospital for a knee fracture, a surgery, or for any other such reason. And maybe it's your second or third visit to the patient, which definitely means you're acquainted with the patient. But if the setting is an accident and emergency, like this example that we're having a look at, the chance is high that you're going to meet the patient for the first time. And if it's a home visit as a setting, again the chances are 50-50. You might be visiting the patient for the second, third or fourth time in case it's a patient for whom you're going to change or help with changing the dressing. It need not be your first visit then. But if it's a home visit and you're there to create awareness about the spread of mosquitoes, then the probability is high that you're meeting that particular person for the first time. So the setting will definitely give you an idea whether you know the patient or you're meeting the patient for the first time. What else do we get to know? Well, from the setting, we will know what tone to speak in. That is, whether the condition is really serious, as in case of accident and emergency. If it's a hospital ward or a school, the condition need not be very serious. So it could be something very simple or that which does not require immediate medical attention, right? Not required. It could also help you decide whether you need to be very serious in the way you talk. Do you need to be calm? All these you'll get an idea just by looking at the setting. Well, so you get to know a lot of different kinds of information from the setting itself. So do not ignore the setting. What after you read the setting? Go straight away to the background information. So let's have a look at the background information. Well, this is a background information and this is the second part of your role card. What are the different pieces of information that you can pick from the background information? You first get to know who you are. That is your job role. You also get to know whom you are talking to, which means, are you going to talk to the patient directly or will you be talking to the bystander or the relative of the patient? From the background information, you will also get to know the medical condition of the patient. You will also be able to pick up the reason for your visit, and the last piece of information that you can pick up from the background information are the physical and mental state of the patient. Do not worry, I will explain to you in detail how you can pick out all these 5 pieces of information just from the background information. The first is who you are. Now here it clearly says you're a nurse, but sometimes it could be mentioned that you are the head nurse, in which case you would know what exactly your role is. So you could just be one of the registered nurses, you could be a head nurse, or the job role could be a nurse manager. So the first piece of information you can pick is your job role. And in this example, we know that we are the nurse. Second piece of information, who are we talking to? You are talking to a 21-year-old patient. So we know it's not the bystander, but we are talking to the patient directly. We also know the age of the patient. Getting to know the age of the patient is also important. Why you would think so? Well, if your patient is 60 years or above, which means it's an elderly patient, you know the kind of attitude that patient might have. You know you have to be careful in the things that you convey. If your patient is a child, let's say 10 years or below, again, you need to be really careful when having a conversation, because a child will not understand a lot of things that we say. So we know we need to adjust our tone, our choice of words accordingly. Well, if it's a middle-aged patient, we know the kind of approach we need to have when talking to that patient. And if it's a teenager, again, there could be challenges in talking to the patient, because sometimes teenagers are not ready to accept certain suggestions and advice that we give them. So we need to handle each category, the age according to the category, we need to handle our patients with a lot of care. And it's the age that helps us decide the tone we need to choose, the kind of words we need to have in our conversation. After we get to know whom we are talking to, we need to try and find out what is the medical condition of the patient. So when we read ahead, we find it's a 21-year-old patient who sustained severe burns to her arm. So we know that this is the medical condition of the patient. Okay, so why are we visiting the patient? Now, she is currently in pain, that is one reason, and the patient has been told she will need to have a skin graft, which means the patient will have lots of questions to ask you, and that is your reason for visiting the patient. The last piece of information you need to pick up are the physical and mental state of the patient. Now, in this particular background information, we know that the patient is in a lot of pain. So, we know the physical state of the patient, but the mental state is not clearly mentioned in the card. But we can, we have an idea. We can understand the kind of mental state the patient would be, because this patient has to undergo a skin graft and is in pain. So, the patient will have questions to ask, the patient could be anxious, could be worried. So, that is the mental state of the patient. In certain of your cards, it will be clearly mentioned what exactly the mental condition of the patient is. Sometimes you have words like the patient is anxious, the patient is worried, the patient is embarrassed. So, you know how to approach the patient. So, these are the 5 pieces of information that you can pick out from the background information. So, do not miss out on these. Now, let's move ahead on to the third and the last part of your role card, which is the list of tasks. Well, the last part is your list of tasks. We know by looking at the tasks here, we have 1, 2 and 3 tasks to perform. Sometimes a role card will have from 3 to 8 different tasks. Now, this is a comparatively simpler role card because it just has a list of 3 tasks. If you see a list of 6, 7 or 8 tasks, do not worry, because there is no rule as such, or there is no compulsion for you to finish all the tasks in the 5 minutes of your role play. But you need to cover as many as possible. And in this case, you just have 3 tasks, so completing them should not be a challenge. Nevertheless, there is a risk. When you just have 3 tasks on your role card, the chance is high that some students, nevertheless, when you have just a list of 3 tasks, the chance is high that some students may finish their speaking just in 3 minutes and might not know what else to do in the remaining 2 minutes. But the interlocutor will give you exactly 5 minutes to finish the card. So, you need to manage time, you need to make sure you're utilizing your time effectively. So, let's see how the list of tasks will help us in preparing for the role play. So, we need to focus on those key words. What does task 1 ask you to do? You have to answer the patient's questions. So, here it means you have to give information. And for you to give information, the patient should first ask you questions. Now, you might be wondering, how will this happen? Because in OET speaking, it is the candidate, which means it is you who will have to initiate the conversation. The interlocutor has no role in it. You have to initiate, which means start the conversation, and it is you, the candidate, who will have to ensure that the conversation continues for the entire 5 minutes. So, if you stop talking, the interlocutor will not really help you, and the interlocutor will also keep quiet. Which means, if your first task says, answer the patient's questions, you have to first prompt the patient to ask you questions. You cannot just wait thinking, okay, the patient will ask me questions and then I'll answer. No, we have to initiate the conversation. So, keep that in mind. If your first task is always answer the patient's questions, make sure you prompt the patient to ask you those questions. Do not worry, in a while I'll tell you how that can be done. Let's look at the second task. The second task asks you to reassure the patient, which means you have to build confidence, okay, and which also means you will have to convince the patient. And in the same task, it also says offer to arrange. What do you mean by offer? This means you will have to suggest, or it also means you have to extend help. And the third task asks you to explain to the patient. So again, this means you have to be giving information. Now, whenever your task asks you to explain something to the patient, remember not to go straight ahead and start talking in detail about all the information that you need to give. Instead, you need to first ensure that you check how much the patient already knows, how much the patient is already aware about the condition, and then add on additional information. You might be wondering, why should I check with the patient? Because my task says explain. So shouldn't I just go ahead and start talking about it? No. The assessment factors is a major reason why you should first check what the patient already knows about the condition. Because the assessment factor clearly mentions that you need to understand and incorporate the patient's perspective. It is based on these assessment factors that the examiners evaluate your role play. So if we do not check what the patient already knows and only then go ahead to give our information or explanation, we are not adhering to one of the assessment factors. So we need to keep in mind, whenever the task asks you to explain, which just means that you need to give in a lot of information, your first step is to check how much the patient already knows. Appreciate if the patient knows something about it, and then go ahead and add information. Now, what if the patient has no idea about it? Console the patient. Reassure the patient. You can say things like, do not worry, I'll give you all the necessary information. Or not to worry at all, I'm here to help you, and then add on your information. Alright, so let's look at these tasks in a little more detail. Now, because you need to answer the patient's questions, I told you, you will need to prompt the patient to ask you questions. So what is the condition that we're talking about here? The patient will need to have a skin graft, which means she will want to know more about the condition. So how do we begin our conversation? First, we will have to greet the patient plus give your reason for visit. Because the setting is emergency, accident and emergency, you have to clearly mention why you are visiting the patient. So when I greet the patient, I can say hi, good morning or hello. I need to keep it short because it's an accident and emergency, and I already know that my patient is in a lot of pain. The background information also tells me that the patient has been told about a skin graft, which means a doctor has already visited the patient and has spoken to the patient about the procedure. So I, the nurse, is meeting the patient, and it's the second person who's meeting the patient, right? So the patient knows about skin graft but has a lot of questions to ask you. So I give a very short greeting. So I say hello, or I say hi, or I could even begin with the patient's name because the doctor has sent me to clarify the patient's question. So I can say hi Miss Steffi, if that's a name, and that's how I can greet. And I can also give my reason for visit. I can say, hi Miss Steffi, I'm here to talk to you about the skin graft procedure that the doctor has spoken to you about. Or, hi, I'm here to clarify any questions you might have regarding the skin graft. So you directly, without a load of wasting time, you just get into the matter that you are here to clarify the questions. Do not ask things like, hi, how is your pain? Are you feeling okay? You look better. What really happened? Can you explain how this whole thing happened? Can you explain the burn? No, we have no time to waste because the patient is in a lot of pain and the setting is accident and emergency. So we directly get to the topic. I'm here to talk about skin grafting. Do you have any questions about that? That's how you can prompt the patient to ask you questions. Because remember, the first task asks you to answer the questions. So when you prompt, when you give the reason and you say, do you have any questions to ask? The patient will definitely say, oh yes I have, and ask you questions. And you need to answer them in a very calm manner. One by one you answer the patient's questions. What next? The patient has asked you 3 questions and you've given all the 3 responses. What do you do next? Well, you will have to reassure. So in your 3 minutes time of planning, you can decide how will you reassure the patient, because this is what we're doing in our 3 minutes time of preparation. We yet do not have an idea of what questions the patient might ask us, but we can imagine the question is about queries regarding skin graft. So the patient might ask a certain set of questions. It might be about what the procedure is, how it is done, how painful it is, probably about the expense of the procedure, or how long will it take to recover. We can guess, we can predict the possible questions. That's all we can do in our 3 minutes time, because we have to wait for the role play to start to know exactly what the interlocutor will respond, right? But we can in the 3 minutes time decide how to go about it. Well, we go on to the second task, which is reassure. So what if the patient asks you 2 to 3 questions? How do you reassure? When you reassure, you can use phrases like, oh, I totally understand what you're going through. Oh, I know exactly how you feel, but do not worry. Rest be assured that things will be fine soon. These kind of phrases can be used to reassure the patient, because you're trying to build in confidence that everything will be alright. And you can give a reason why you feel so. You can add on reasons like you've seen similar conditions before, there have been patients who've undergone a skin graft before, but they've all been alright. But at the same time, you also need to be realistic. You cannot give any false promises. So you have to give a realistic time frame of recovery. Instead of saying you will recover soon, which is ambiguous, you need to say you will recover in 2 to 3 months. Or you can say the recovery period basically depends on a lot of conditions like the health status of the patient and the extent of the burn. So we have patients who recover in a month's time. Now depending on how serious your condition, it could also go up to 3 or 4 months. So though we are slightly vague here, we are still quantifying the recovery period. Instead of being very vague and saying soon or it will take a long time. So be very definite when you reassure the patient. Give exact quantity or quantified terms, give numbers so that the patient can easily relate to it. And that is how they become reassured that things will be fine. So what is our last task? Well, it asks you to explain. So you need to give information. Okay? And this is what you need to convey to the patient. Before you go ahead and give information, check how much the patient already knows. Are you aware of how long it will take to recover? Do you have any idea about the procedure? Do you know something about this already? Check what the patient knows. Depending on their response, you could start your explanation. Well, this is what you can do in your 3 minutes time of preparation. So let me give you a quick summary of how you can utilize your 3 minutes effectively. First, read the setting, because that will help you decide the tone, the language to choose, and also whether you know the patient or you're meeting the patient for the first time. Second, read the background information. You will be able to pick out 5 pieces of information from it, and that will help you decide how your conversation should move ahead. Third, go through the list of tasks. Focus on the action verbs. Words like reassure, explain, ask, suggest. These will tell you what language you need to use and what exactly you need to do. So, these are the things you can do in your 3 minutes time of preparation. And let me remind you one last thing before I wind up the video, that the only thing you can actually prepare for your speaking on the day of the test in your 3 minutes time of preparation is how to begin the conversation. Because once you begin as, "Hi Steffi, I'm here to answer any of your questions that you have regarding skin grafting," the rest depends on the interlocutor's response. So though you can practice how you will begin the conversation, you can just have a preparation on what you will do in the remaining tasks. But whether all of what you prepared will really help you in your conversation completely depends on what or how the interlocutor answers to your questions or tasks. Do not worry, your roll card is aligned to the interlocutor's roll card. So the tasks you need to perform are well in alignment with the tasks the interlocutor will also have to perform. Now let's look at a bonus tip. It is in these 3 minutes that you can get any of your queries clarified from the interlocutor. That is, if you have certain words that you are reading for the first time and you're not really sure of the meaning, you can check with the interlocutor the meaning of that word. Or it could be a medical condition given in the roll card and you're not really sure of it. You could ask the interlocutor for clarification. Here, the interlocutor is free to respond if he knows the answer. Remember, the interlocutor need not be a person from a medical background, which means he might not be able to give you responses or answers to certain of your questions. But you could nevertheless try asking. If he knows, he will definitely help you out. And whatever questions you ask in this 3 minutes preparation time will not affect your score. So go ahead and remove any questions or queries that you might have regarding the roll card given to you in your 3 minutes time of preparation. You can also use this time to check with the interlocutor what name the interlocutor needs to be addressed by. That is, if the patient is a known case. Well, what else can we do in the 3 minutes time? So hope by watching this video, you've got a good idea about what you can do or how effectively you can utilize your first 3 minutes of preparation time. Practice this a couple of times and there you will do wonderfully well in your OET speaking. Thank you so much for watching the video and good luck with your preparations.